Hi, I'm Jessie Gruman, President and founder of the Center for Advancing Health. CFAH works to increase people's engagement in their health care, knowing that we won't get the full benefit of our care unless we participate actively in it. As someone who's been diagnosed with 4 different kinds of cancer, I have a lot of experience with health care and understand personally what it means to engage in my care. If you, like me, have visited the doctor or the hospital recently, you know that finding good care and making the most of it can be a challenge. Advances in medicine mean that tests and drugs and procedures are more effective than ever before, but we often overlook the fact that many of these advances depend on us, patients and our caregivers, to make them work. For example, surgery has improved. You can get a hip replacement or a hysterectomy and come home from the hospital quicker, but also sicker. Then we and our families have to manage the wound care and the diet and the medications and the rehab, all things that used to be done for us by professionals in the hospital. And drugs have really improved. People with chronic conditions like cancer and diabetes and HIV/AIDS can now live long and well with our diseases. But we have to make big changes in our lifestyles and follow complicated instructions if those drugs are actually going to work. When I got my 3rd cancer diagnosis in 2005, my eyes were really open to how our responsibilities have changed. I was just stunned at what I had to do to get good care and to have it have an impact on my health. I had to find the right surgeon, the right oncologist, I had to get the surgery, the chemotherapy, I had to care for myself at home, and then make that long recovery. I really struggled to figure everything out. After I got better, I interviewed hundreds of people about their health care, and I heard again and again how surprised they were by what they were expected to do to care for themselves or for their wife or for their child, and how unprepared they felt to do it. Since I founded the Center for Advancing Health in 1992, we've worked to help people understand their changing role in their health and their health care. The work of CFAH focuses on the actions that we, patients and caregivers, must take in order to benefit from our care. In addition to caring for ourselves when we come home from the hospital and managing the drugs and lifestyle demands of illnesses like diabetes and heart disease, we also have to find the right doctors to care for us. Sometimes we have to get a second opinion. We have to work with our doctor to figure out which treatment will work best for us and then follow through on it. We have to make appointments and make sure every doctor has our health records. We have to get screening tests like mammograms and vaccines like flu shots. And even if we have insurance, we have to pay for our care, the co-pays, the deductibles, and the bills. Now, none of us has to do all of these things all the time, but all of us have to do them at some point. And we have to know that we have to do them, and we have to know how to do them in order to get the best results from our health